So in today's session, we will do the topic on food poisoning. Okay. It's chapter 35, food poisoning, chapter 35, page number 480, those who have the textbook. If anyone is joining late, please help them out with the page numbers. So the characteristics of food poisoning, usually food poisoning will start as diarrhea and vomiting. Okay, but it has other characteristics as well. There is an onset of vomiting, diarrhea, stomach ache, abdominal cramps. Okay, with whomever has the symptoms of um, food poisoning within 24 hours of having a contaminated food, your body will show these signs and symptoms. And also occurrence of the same signs and symptoms. You will notice this in all the people who have ate the same food. Okay, people who have eaten the same food, maybe it was a family outing. Okay, everyone in the family, whoever has partook in eating the same food, will show the same kind of illness and signs and symptoms. Okay, so it's visible in two or more people. And the causative agent here is either bacteria or the toxins of the bacteria. Okay, any of one of this can cause food poisoning. And this definition of food poisoning, like if we say about only bacteria and toxins, it means we are excluding other contaminants, chemical contaminants in food. Okay, that can also cause food poisoning, like hepatitis. Okay, enteric fever. This can be caused by some toxins which are not from bacteria but from chemical toxins as well. The 6 Fs that lead to foodborne diseases. Okay, what are the agents that could transmit foodborne diseases? First one is flies. Okay, flies that sit on top of the food. Any food that is contaminated or a lot of fly is roaming around by any food, it means that that food could be contaminated. Okay. Then you have food itself. If certain food has become bad, gone bad, okay, any fungal or bacterial infestation has taken in the food and it has gone bad, there is secretion of certain toxins in the food. That could also cause food poisoning. Then any fluid, okay, not just the eating food, any drinks as well, okay, can cause food poisoning. Milkshakes, juices, smoothies, okay, fingers, if it is not clean, not washing your hand properly before eating food and all, okay, that could lead to food poisoning. Then feces, like cholera, typhoid and all, okay, these kind of food poisoning, it can be transmitted through fecal contamination. Okay. Then fomites means these are objects, okay, non-living objects like nor doorknob, dishes, cloth, okay, utensils. These are fomites because these can be used by an infected person, and by the direct contact, these fomites can become infected, and anyone other than the infected person, if they are using these objects, they will also get the infection. So that is fomites. They play a role in transmission of the disease. Then we have staphylococcal food poisoning. So there are Staphylococcus A, B, C, D, E. Okay, these are different types of Staphylococcus enterotoxins. Okay, which are usually in found in Staphylococcal food poisoning, and these strains are heat resistant. Even if you're heating the food, even if it is cooked food, okay, still these toxins can cause poisoning. It can spread. Streptococcus aureus or Staphylococcus aureus is the culprit here, and it is the common source you will find majority of ham, pork, canned beef, okay, cream-filled pastries, and all these are major sources through which staphylococcal food poisoning can spread. And the incubation period is usually 1 to 6 hours. Within 1 to 6 hours, like once you have this food, okay, it has entered your system. Within 1 hour to 6 hours, you will start showing the symptoms. Okay, once the bacteria has entered your system and the first time the signs and symptoms start developing, that duration is called incubation period. So what you see here is nausea, vomiting, diarrhea. The person may collapse, okay, faint. Usually, you will not die. Okay, mortality rate is very uh, low in this. Okay, if you check the vomitus, that is, if you collect the sample of the vomitus, the person has vomited out, collect that sample and give it for examination, or do the stool examination, stool sample, okay, or food sample, give it to the examination. That can also confirm the diagnosis of staphylococcal food poisoning. Isolation is indicated here because even if you touch certain areas and it is, if these areas are used by other people in the home, they can also get infected. Treatment is done by proper hydration, and antibiotics are not that helpful here. Next is Bacillus cereus. So these are rod-shaped bacteria. Bacilli means rod-shaped bacteria. So it is an aerobic spore-bearing gram-positive bacteria, Bacillus. So it requires oxygen to thrive. And the common sources through which you get Bacillus poisoning is fried rice, meat, meatballs, beef, barbecued chicken, okay, vanilla sauce, cream sauce, okay, these are the sources. There are two types of Bacillus cereus infection. One is emetic type, in which there is a lot of vomiting and the person will collapse. The next type is diarrheal type, in which there is a lot of diarrhea present. Okay, not much vomiting, but diarrhea is prevalent. In the first type, there is only vomiting. Okay, diarrhea may be a late symptom. So again, incubation period is depending on the type, it is 1 to 6 hours or 6 to 14 hours. Okay. Diarrheal type shows the symptoms quite late. So diarrheal type incubation is 6 to 14 hours. Diagnosis, again, you can take the diagnosis from the vomit sample, stool sample, food sample. You can only do the symptomatic management of this condition. Then you have Clostridium perfringens. So in this is a gram-positive bacteria. It also has spore. It is already, and these spore-bearing bacteria, it can kind of kill the anaerobic bacteria that is present in your intestine. Toxins are released from the spore of this bacteria. It also causes epithelial damage in your intestine. And it produces watery kind of diarrhea. Type A produces water diarrhea. Type C produces blood in diarrhea with because it damages your epithelial tissue in your intestine. So bleeding will be there. Okay, so that's why bloody diarrhea will be there. If you are not cooking the meat properly, okay, especially when large quantities of meat is cooked in parties and festival, if it is not cooked well, okay, chicken, turkey, beef, okay, uh, poorly cooked pork, okay, these are the causes of it. And cooking also will not kill organisms in large chunks of meat. If it is small chunks of meat, it is still possible. But if the meat portions are quite big in size, cooking enough is not enough to kill the bacterial spores. Incubation period is around 8 to 22 hours. And again, symptoms are watery diarrhea, nausea, vomiting, abdominal pain, fever. If you want to do the diagnosis, take a stool sample, rectal swab, food, you can give it for culture testing as well. Then you have Vibrio parahemolyticus. So it's a rare type of food poisoning. Incubation period is 2 to 48 hours. Average is around 12 hours. Okay. And the manifestations, the symptoms of this condition are there is again diarrhea, a fainting, that is collapse, nausea, vomiting. And usually you get this through seafood, um, some salted vegetables, salt water. Sea water is also a source of this. Usually it is seafood. Okay. Stool swab, rectal swab, stool sample, food sample can be given for confirming the diagnosis. Some antibiotics like tetracyclines will work here. Trimethoprim, methoxyzolone, these are beneficial, these antibiotics. Next, you have Yersinia enteropolitica. So again, diarrhea. Sometimes it is bloody diarrhea, bloody vomiting. There is a lot of inflammation in the pharynx, sometimes arthritis, adenitis. Okay, that is your lymph nodes will become swollen. Okay, and usually the sources of this condition are chocolate milk or having raw milk, pork. Incubation period is just 2 hours to several days. Usually 3 days also it will take for the symptoms to come up. And you can do the blood culture or serology. And treatment can be done for symptomatic management. Some antibiotic symptoms can also be given. Streptomycin, tetracycline, these are antibiotics. Cotrimoxazole. So these antibiotics are effective. Then you have Listeria monocytogenes. Again, it causes diarrhea, nausea, muscle aches, fever, stiff neck. In some situations, it can lead to convulsions as well. Confusions, convulsions, loss of balance, person may collapse, faint, blood may be present in the stool. Okay. And the sources of this infection could be dairy products, milk, raw vegetables, uncooked raw vegetables, not washed properly, poultry, meat, beef. And these monocytogenes, they are known to invade other organs as well. Like it can invade into your brain, your meninges, okay, GI tract, bloodstream. Ampicillin, that's an antibiotic. It can be useful here, and symptomatic treatment can also be done. Then you have Campylobacter jejuni. It produces diarrhea, cramps, collapse, and sometimes blood in the stool. Sources are milk, chicken, beef, and sometimes pet animals can also be a source for this. It can also cause irritable bowel syndrome in some people, temporary paralysis, arthritis. Erythromycin, macrolides, these are the antibiotics effective here. Then you have E. coli. E. coli is a bacteria which is already present in your intestine, in your intestinal flora. And there are 6 different types of E. coli that can cause food poisoning. The names of the E. coli is mentioned in your textbook. Sugar toxin producing E. coli, enterotoxigenic E. coli, aggregative E. coli, enteroinvasive, enteropathogenic, okay, diffusely adherent toxin producing E. coli. These are different types of E. coli present. and it produces a lot of cramps, abdominal cramps, watery diarrhea, sometimes bloody diarrhea as well, nausea, vomiting, fatigue, low grade fever. Again, incubation period is just 1 to 5 days. If you consume unpasteurized raw milk, soft cheese made up of unpasteurized milk, salads, beef, okay, these are our sources. Then salmonella, that is typhoid, caused by Salmonella typhi. So there are different types of salmonella as well, which causes different kind of this, which are involved differently in causing diarrhea. And salmonella is the most common type of foodborne diarrhea. And it can be, the salmonella strain can be found in your pet animals as well, domestic animals, pet animals, egg preparations, meat, poultry. Okay. There could be diarrhea, collapse, nausea, vomiting, blood in the stool. Antibiotics like nalidixic acid, cotrimazole, third generation cephalosporins, these are indicated in dysenteric type of salmonella diseases. In mild cases, mild antibiotics can also help. Then you have Shigella. Am I audible? Is my voice clear? Am I audible? So next is Shigella. So that can also lead to fever, diarrhea, blood in stool, nausea, vomiting. Okay. In some very severe condition, it could lead to hemolytic uremic syndrome, seizures, convulsion, post-infection arthritis. Okay. Sources of Shigella infection is raw milk, salad, potato, tuna fish, turkey, young children, people who keep traveling, okay, homosexuals, people who have weak immune system, okay, they have high likely to get Shigella shigellosis infection, that is Shigella infection. Stool swab, rectal swab can be taken, even from the food handlers. Uh, Cotrimoxazole, nalidixic acid, cephalosporins, these are the antibiotics which can be useful. Next, you have Clostridium botulinum. So botulinum is a toxin here. It's a very lethal toxin. If you get at least 10 to 7 mg of botulinum toxin in your body per kg, it is toxic. It could lead to human botulism. It's a neuromuscular disease. It can cause death as well, or respiratory paralysis, because of which there could be death. It's a gram-positive infection. So foodborne botulism is due to the if this toxin is preserved in the food, even after heating it, if the toxin does not get destroyed, it could lead to foodborne botulism. Wound botulism, it's like if you get hurt, if there is an open wound and the spores of the botulinum spores get attached to your open wound, that could lead to wound botulism. Low acid canned food, if you are using canned food, if it does not have enough acidic environment, that could lead to botulism. There is nausea, vomiting, diarrhea, blurring of vision, dry mouth, dysarthria, diplopia, descending paralysis, that is paralysis that goes towards your feet, okay? Because it affects your neuromuscular junctions in the central nervous system. So some treatment is supportive with antibiotics like cotrimoxazole, nalidixic acid, cephalosporins. Okay, this can be used for secondary infection treatment. Neuromuscular blocking action medicines should be given. Mushrooms. There are some poisonous mushrooms like Amanita phalloides, A. muscaria, A. bressa, Galerina venenata. Okay, these are toxic mushrooms. It can upset your stomach. It could lead to hemolysis, multi-organ failure, paralysis as well. Atropine is an antidote for certain mushroom poisoning like A. muscaria. Gastric lavage is indicated in mushroom poisoning. That is, you will put normal saline through NG tube feeding. You will flush your stomach with normal saline. Penicillin can also inhibit the intake of toxin into your liver. Dialysis can also be performed, peritoneal dialysis. Then shellfish or other seafood. So they also cause a lot of allergies as well, not just food poisoning, but allergy as well. So there is an algae bloom, dinoflagellate bloom, that is a algae in the sea during that time. Um, if you're consuming shellfish or if you're breeding shellfish and taking it for consumption, that could lead to uh, shellfish disorders. It could lead to poisoning. Even using mussels, okay, black mussels, scallop, okay, even using eating these seafood could also lead to ingesting these toxins and lead to shellfish poisoning. Shellfish as it is not poisonous, but certain seasons, if you're using shellfish, it could turn poisonous. It could upset your GI tract, okay. It can lead to paresthesia, vertigo, ataxia, a sensation of floating. Okay, you don't have grounding of your leg and feet. You can feel very light. Paralysis of your diaphragm, which will lead to not be able to breathe properly. So symptoms can persist for several weeks as well. So that's about food poisoning.